Good morning, dear friends. Today we are going to discuss about the shock and its management. Now, there are various definitions for defining shock. One of an important definition is shock is the condition where heart is not able to pump a sufficient amount of the blood so as to maintain normal perfusion pressure. Now see here, in shock, there is failure of circulatory system to maintain adequate cellular or tissue perfusion. Therefore, ultimately leads to number one, decrease in oxygen delivery and B, decrease in nutritional supply to tissue. So, the shock represents a failure of blood flow rather than a fall in blood pressure, and the diagnosis of shock is based not on the level of arterial blood pressure but on the signs and the symptoms of inadequate perfusion of vital organs. So let us discuss about the physiology of this arterial blood pressure. So arterial blood pressure and cellular perfusion are dependent on number one, cardiac factor that includes cardiac output, stroke volume and heart rate. Number two, vascular factor that depends upon the sympathetic tone endothelial nitric oxide level. And number three, the humoral factor that includes circulating mediators like angiotensin 2, renin, vasopressin, prostaglandins, kinins, etc. And the last one is the microcirculating factors, which includes local metabolite, pH, hydrostatic pressure, etc. So, the symptoms of the sympathetic overactivity of tissues are generally seen like pallor, skin color changes, sweating, cold extremities, and tachycardia. Now we will define or the classify the shock. So the shock may be number one, hypovolumic shock, cardiogenic shock, septic shock, and neurogenic shock, along with some other type of shocks also. So number one, hypovolumic shock. It is a condition where there occurs decreased fluid volume due to sudden loss of plasma or blood, as in hemorrhage, burn, or dehydration, specifically during diarrhea or fluid depletions, which ultimately results in hypovolumic shock. The second one is cardiogenic shock. It is also called as myopathic shock, and it is due to failure of the heart as a pump, as in myocardial infarction. Then septic shock. It is also called as distributive shock and is precipitated by several bacterial infection. It may be due to release of the bacterial toxins, which ultimately leads to dilatation of the blood vessels. Then number four is the neurogenic shock, and it is due to venous pooling as the following spinal anesthesia or abdominal or testicular trauma. The fifth one is the anaphylactic shock. It is also a one type of hypersensitivity reaction causing release of massive amount of histamine, which is triggered by antigen antibody reaction. The number six is the distributive shock. It includes septic shock, toxic products, anaphylactic drugs, anaphylaxis, neurogenic, and endocrinal shock, or like this. Then extracardiac obstructive shock is the pericardial tamponade, pulmonary embolism, then severe pulmonary hypertension, etc. leads to this extracardiac obstructive shock. So these are the classification. This is the classification of the shocks. Then come to individual type of shocks. Number one, hypovolumic shock. Now, this results from external or internal loss of blood or plasma or water following hemorrhage, trauma, burn, and protracted vomiting or diarrhea. In this type of shock, the major hemodynamic abnormality is compensatory vasoconstriction, decreased venous return, and a low cardiac output due to reduced plasma volume. The therapy consists of appropriate fluid replacement, then using saline, plasma, or blood and corrective of acidosis. Then extreme vasoconstriction may be diminished by using alpha adrenoceptor blocker as a blocking agent like phentolamine or phenoxybenzaimine. The second one is the cardiogenic shock. It is due to acute myocardial infarction. There is failure of the heart as pump. The hemodynamic pattern usually consists of reduced cardiac output and normal or increased peripheral resistance. Therapy consists of relief of pain and anxiety, oxygen administration to antagonize tissue hypoxia and acidosis, use of thrombolytic agents and anticoagulants, vasopressor or vasodilator agents or drugs. The third one is the septic shock. It occurred during the course of gram negative or less commonly gram positive bacteria or infection. Treatment consists of intensive antibiotic therapy, maintenance of adequate circulating volume by fluid replacement, use of vasopressor drugs like dopamine, dobutamine, and corticosteroid administration to suppress the systemic reaction to endotoxins. Now, in this diagram, you see this is hypovolumic shock. It is because of the fluid loss or hemorrhage, there occur decreased preload. Then cardiogenic shock, it's because of myocardial infarction or necrotic injury. Again, there is decreased heart function. Then extracardiac obstruction, that is pericardial tamponade, decreased filling pressure. And the last one is the myocardial dysfunction, that is because of the distributive type of damage. There occurs increase, or you can say the cardiac output remain normal. So all this kind of shocks ultimately leads to decrease in the systemic vascular resistance, which ultimately causes decrease in cardiac output, which ultimately leads to decrease in the perfusion pressure, and because of decreased perfusion pressure there occurs multiple organ failure. Now, anaphylactic shock, it is due to hypersensitivity reaction and is characterized by extreme vasodilatation, increased capillary permeability, exudation of fluid in the tissue, angioneurotic edema, and bronchoconstriction. Treatment consists of administration of adrenaline, antihistaminics, corticosteroids, oxygen, and fluid replacement. Now see, it is the pathogenesis of hypovolumic shock. You see, because of the hemorrhage, there occur decrease in the circulating volume, which ultimately leads to decrease in the cardiac output. Because of decreased cardiac output, there occurs decrease in the arterial pressure, which ultimately leads to vasoconstriction, which causes tissue hypoxia. Tissue hypoxia leads to acidosis, which ultimately lead to cell death, right? You also see because of the decreased arterial pressure, there occurs decreased renal blood flow, which ultimately leads to renal failure. And because of tissue hypoxia, there also occur decrease or release of the mediators. This mediators causes vasodilatation. These are endotoxins, and ultimately allergens also causes release of the mediators. Burns and trauma also releases or causes vasodilatations. So this is about the overall pathogenesis of hypovolemic shock. Now, shock of any type needs immediate treatment. The cause should be identified and treated first. Symptomatic management is very important. Maintenance of the BP and plasma volume is required. Correct the acid base and electrolyte disturbances. Ensure adequate urine output. This all the things are very important. Along with this aim of the therapy, is the two basic aim in the therapy of shock are to eliminate the initiating cause and to correct the hemodynamic disarrangement. To correct the hemodynamic rearrangement, it is first necessary to ensure adequate fluid replacement and venous return regardless of cause. In shock, where the blood pressure is inadequate to perform vital organs, it is treated by using drug having positive inotropic and vasoconstricting action like noradrenaline, dopamine, dobutamine, and metaraminol, etc. The drugs are given in the smallest effective dose for shortest time to avoid excessive vasoconstriction. In shock, where the central arterial pressure is sufficient but blood flow to the viscera is reduced due to vasoconstriction, drug having positive inotropic effect and vasodilating actions are indicated. Combination of noradrenaline and phentolamine or dopamine with isopentrelline may be effective. The drug used in the therapy of shock, blood loss. So you will have to administer blood, fluid, blood, plasma expanders, then dopamine, alpha blocker, etc. With acute myocardial infarction, then prescribe analgesics like morphine, dopamine, dobutamine, thrombolytic agent, anticoagulants, etc. Anaphylactic shock, adrenaline, corticosteroid, septic shock, antibiotics, fluid, corticosteroids. Then sympathomimetic these drugs maintain perfusion of vital organs by one or more of the following mechanism. Number one, by increasing myocardial contractility, which increases cardiac output provided the venous return is adequate. Then constricting the capacitance vessels, venules, and preventing pooling of blood in the veins. And number three, dilating arterioles in the vital organs. The various asymptomatic used in the treatment of shocks are adrenaline. It is used mainly in the treatment of anaphylactic shock. Noradrenaline, it raises the perfusion pressure and the cardiac output in patients of shock with very low peripheral resistance. And dopamine, it is employed in the management of cardiogenic shock, septic shock, and traumatic shock alone or in combination with an alpha adrenoceptor blocking agent. It stimulates heart and increases cardiac output by acting on cardiac beta receptor and improves renal and mesenteric blood flow by acting on dopamine receptors. Dobutamine it acts mainly on beta 1 receptors with fever vascular effects. It is used for short term therapy specifically of severe congestive cardiac failure and in the patients following cardiac surgery to increase cardiac output. Other sympathomimetic agents used are metaraminol, methoxamine, and phenylephrine. Alpha adrenoceptor blocking agent that includes phenoxybenzamine has been used in traumatic or surgical shock after adequate replacement of fluid volume. It reduces vasoconstriction produced by the reflex release of noradrenaline and it also prevent harmful effect of vasoconstriction on microcirculation. Number two, peripheral permits rapid administration of IV fluid without increasing central venous pressure. Dextron and other plasma expanders. High molecular weight dextron means molecular weight of approximately 1,10,000 and low molecular weight dextron that's of molecular weight 40,000 are used in the treatment, specifically emergency treatment of hypovolemic shock. They expand plasma volume temporarily by exerting osmotic pressure and drawing fluid into the vascular space, thus improving blood flow. Glucagon It increases myocardial contractility and improves the hemodynamic status of patient in acute cardiac failure following cardiac surgery. Shock following myocardial infarction and in the treatment of beta adrenoceptor blocking overdoses. Corticosteroid, these are useful in the management of anaphylactic shock, septic shock, and the shock due to acute adrenal insufficiency. Uh, Proper antibiotic cover should be done if it is used in septic shock. And oxygen, it is used in the patient of cardiogenic shock having dyspnea or sinuses due to arterial hypoxia. Thank you. Thank you very much.